Hi, I'm Bill Coye. I'm a member of the Board of Selectmen here in the town of Plaistow, and I'm joined tonight by a fire chief from Plaistow, Fire Chief Chris Knutsen. How are you tonight, Chief?
Doing great. How you doing?
Good, very good. And we're here tonight. What we want to do is we want to discuss the new big change coming to town, the ambulance service.
We have some exciting news coming to town with the Plaistow Fire Department will be providing our own transport services for our town and residents.
Perfect. It's exciting, and I know a lot of the residents out there are probably curious. They have a lot of questions. And I know even after we do this, you're probably still going to do maybe some things at the library to meet the public, to answer further questions as we go.
You know, absolutely. We do understand and anticipate that the community might be curious about what we're doing and maybe what it costs, what the impacts would it be, what we're improving in the system. And I make myself available pretty much any time anybody wants to come by the fire station, but we're also going to queue some town meetings, if you will, at some various locations to try to invite people, the public, to come so they could to see what the change is and how it's going to benefit this community.
All right, perfect. Currently, what does the current ambulance contract provide?
So for the longest time, the town of Plaistow shares a contracted ambulance provider. So this is essentially kind of like a for-profit company that's came in and offered a contract to provide services for our town and 5 other communities. So there's 6 total. It's the town of Plaistow, Atkinson, Hampstead, Sandown, Danville, and Newton. So in those 6 communities, we have 2 ambulances. That's all it's available to.
And where are they currently housed?
They're coming from Atkinson Fire Department and Hampstead Fire Department.
Okay, so they're not currently in Plaistow.
They're not currently coming from our town, so they have to drive to our town. That's if they're in quarters and not at a call or at a hospital or somewhere else. We used to have a third that they would float from Haverhill to come to the line, but that's not been available. For the last several years, we've not had that available to us. So again, the 2 ambulances covering 6 towns, neither one of them are housed in our community, and they're serving a permanent population of about 40,000 people. When you start adding transient daily population changes and people driving through these communities, now you're talking these 2 ambulances are probably trying to protect around 60,000 people.
Wow. Wow. When did the fire department start looking at changing the ambulance service, and what are the reasons behind it?
So the contract that we had, that company got bought over, I want to think it was early 2022, and the new contractor essentially bought that contract with no changes to it. We were seeing a need to have a 3rd ambulance for these 6 towns. The call volume and the timing of calls, we were seeing on a frequent basis that we did not have an ambulance available. Other communities are also seeing that they don't have an ambulance available because those 2 are already committed to calls. I started initiating conversation with the other 5 fire chiefs. Early summer 2022, we met with our contractor to see about adding a 3rd ambulance to our contract. They weren't interested in doing that. We kind of asked about, why do you need more run numbers? We tried to see if other communities wanted to be involved and utilize that 3rd ambulance sometimes if they needed help. And that conversation really didn't go anywhere. Okay. So now the 6 towns, we started working together to see what we could do to change, because it wasn't just a town of Plaistow, it was other communities also having problems with having that resource that they need. And we've been working on that really much since the summer of 2022.
Right, I know it's been a work in progress.
It's been a work in progress. There's been a lot of thought go into it, a lot of research go into it, essentially developing a business plan.
Right, exactly. And what was the process used for developing the ambulance service going forward?
So the big thing is making sure there's a need, right? And I think it goes without saying that there's definitely a need. We're running between 1,500 and 1,600 calls a year in Plaistow. We've had increases in call volume every year now for the last 3 or 4 years, about 12 to 15% every year. We're seeing an increase in the amount of times that our contracted ambulance is not available. So you start looking at all those issues, putting them together, and then looking at solutions to try to fix that problem. You look at on in our town alone, how many calls are ran at the same time versus does that ambulance have time to turn around? And historically speaking and statistically speaking, is there enough time for that ambulance to turn around and catch another call? Essentially, we looked at the type of calls that we're transporting to see, do we need paramedics, do we need EMTs, what hospitals are we transporting to the most, what call types, and then the biggest thing is methods of payment. So we could see what the collection estimation would be on insurance collections as well.
Right.
Then we take that and we start putting it to a budget. You kind of develop the need. So now you start developing what resources that you need to put in place and start developing a budget for that. So you can start saying, what's this going to cost to be able to make this transition?
Right, exactly. And how do you plan on staffing for the ambulance and going out and finding employees for it? Because I know that's an issue.
That is an issue. It's an issue across not just the state, but across the country. So there's a little bit of a worry with attracting employees. What I've been telling people is any successful business plan, it doesn't matter what you want to do, right? If you want to open up a restaurant, a clothing store, if you're trying to develop an ambulance service, right? You have to have a business plan. And if you want to be successful, you have to have some type of hook, right? What are you going to do different to attract employees? If we're paying the same amount as our neighboring department, or another department in the state, why would that employee want to leave that employer to come to the town of Plaistow? So we have a lot of good things, I think, that's helping build that hook. It's not just one, it's multiple different things. For one, the town is a great town to work for. The people are a great town to serve, right? The population. We're doing our shift scheduling a little bit different, so we're offering more hours in a year. Versus any other fire department in this state. So most fire departments up here run 4 different 24-hour shifts. And we're going to run 3. Okay. So what that does, that builds in some extra time on their payroll to where they can make more money here. They're working more, but they're making more money. Most of these employees that work for another fire department, because they have so much time off, they'll pick up a part-time job. Because they're trying to supplement their funds. So we're doing with actually less money than it would take to have 4 shifts. We're doing 3 shifts, offering more base hours, which increases that annual salary to help attract employees. Okay. Another part of the hook is a lot of the fire departments up here want to employ firefighter paramedics because they're going to share them on the fire engine and the ambulance. Well, we need to staff an ambulance. I already have staffing for the fire engine. So we're willing just to hire paramedics, and we want good paramedics. Right. We don't want someone that's sharing so many responsibilities that they can't be good at all of them. So we've opened up our hiring process to firefighter paramedics, and we've also opened it up to paramedics only. Yeah. Right. So now it has opened up that hiring pool to attract and recruit the right person for this job, and the job is on an ambulance. So we've changed a bunch of things that's not common to other departments here to create that hook to attract people to want to come and apply here. And
with those changes, you feel that will help with the retention?
It will help with not just recruitment, but will help with retention. So when you look at recruitment, you got to have a hook to get the employee in the door, right? Now it's up to us to retain that employee once they're in the door. Right. You give them a good work environment, you give them a good schedule, you don't burn them out working a ton of overtime, you give them good equipment that they need to be able to perform their job duties, and you give them a decent benefit package, you're going to keep these employees.
Right. And going forward, what's the expected cost and the recovery to the town to recoup some of that cost back?
So we're doing a blended model with full-time staff. It's currently at the fire department, and more full-time staff we're going to add to the ambulance, and then we're also adding some part-time or per diem staff to help offset that cost. So the initial employees that we're hiring, we're only adding 3 more full-time employees to our department. It's 1 paramedic for each of those 3 shifts. And then we're going to add some per diem or part-time paramedics to that as well. So when you look at our cost, that's our biggest cost is salaries. That's our biggest reoccurring cost is salaries.
Sure.
So we're doing a blended system to keep that cost to a minimum. We already have the infrastructure. So when you were looking at the business plan, when we were looking at do we need to make this change, we're already buying all the infrastructure. We already have a dispatch center. We already have an ambulance. We just had to buy another ambulance because our current ambulance is getting some age and wear on it. We already have all the heart monitors, the ventilators, the medications, everything that goes in the ambulance. So only thing we really needed was to hire the people. So now we could start transporting and recovering the funds. So when you look at the budget, I want to think we're like 680,000 for the budget to add the ambulance.
And that's what's projected.
That's what's projected, and then that's going to be offset. Probably 72 to 75% of that's going to be offset by our insurance revenue that we're going to bring back in. So I guess a big concern that a taxpayer might see is we have to put in the budget what our expenditure is, right? We have to put that in there, but that's going to be offset by the insurance revenue, because when we transport a patient, it's not for free. Right. We charge the insurance, we charge the individual, and we charge the insurance companies.
Right, and as that money comes back to the town, it would go back into the general fund.
Absolutely, it's going to go back into the general fund. So we do. Yeah, there's some options out there. Do you want to make a revolving fund? Yeah. But at the end of the day, we're not going to recover 100%. There's no need to create a revolving fund. The taxpayers deserve to have that relief put back on their tax bill. Yep. So we're going to be able to take that recovery and put it back out there.
Right, exactly.
So it looks like a scary number, but at the end of the day, it really isn't that huge of an increase because of our collection.
Yeah, it's just that initial cost you see up front, what it would cost, but as you're getting the money back in, and at the end of the year, it goes into the general fund, which, goes back to the town.
Goes back to the town.
The town
yep.
people. So that kind of answers another question. So really for infrastructure, we're pretty much all set up for the infrastructure piece of it.
We're there, and we've been there, and that's it's not really the frustrating part, but it's almost the frustrating part is the taxpayers have already spent hundreds of thousands of dollars on the infrastructure. Right. We might as well use it now and recover some of that money back.
Yep, and as was stated, we have a new ambulance coming that's already been paid for, and we're expecting that somewhere late February, early March, somewhere in that time frame?
We ordered the ambulance, I think it was May of 2022. A couple months ago, we actually changed a little bit to get it sooner. And it's scheduled to be around late February, probably March, right when we're starting this process. We're going to be getting a new ambulance for as well.
Right, just so everyone understands. So that would be the primary ambulance.
That will be the primary ambulance.
And then we'd also have a backup ambulance
We also have our current ambulance that we have now. It's not in terrible shape. I would not want to run it as a frontline ambulance for long, but it'll be a great secondary ambulance if we get 2 calls in a row, and it would be a great reserve truck to use when our primary ambulance is down for maintenance.
And then probably the big benefit is both of those are going to be right at the fire station.
Both of those will be right here in the center of town at the fire station, and staffed and ready to respond.
And dedicated to the town of Plaistow.
Dedicated to the town of Plaistow.
So we're not worrying about someone on another service. They could be on 2 calls, and who knows how long it would come.
Correct. Yeah. We do, just to be transparent, we do help with mutual aid calls. Sure. But I've been pretty clear with the other communities that we can't abuse that. So if a community every so often needs our help, we'll be glad to help them. If we need their help, they're going to come help us.
Okay, perfect. And are there other communities, around Plaistow that are currently doing this, that have their own ambulance service?
The majority of the fire departments in New Hampshire provide the transport service for their communities. You go one direction here, the town of Salem provides transport service. You start going down 125, and as soon as you hit Kingston, pretty much all the way down 125, all those departments, Kingston, Brentwood, Epping, all those provide their ambulance transport service for their community.
So they're all doing it in town?
They're all doing it in town.
Okay, so no other service. Okay, interesting. And what would the current cost be as you're looking at everything for a private company to provide the same service?
So we sent out requests for proposals because it was important to us to make sure we were doing the right things and making sure we were doing things the most cost-effective way possible, right? So when you're developing that business plan, okay, we want to make a change. Here's our options, and here's what the cost of those options are. So we, as a town, sent out a request for proposal for one ambulance. So the same thing that we're increasing to, then increase one dedicated ambulance just for our town. What would that cost? And the lowest contract number we got back was $1.1 million.
And for out of that 1.1 million, for the services for the transport, who would get that money?
The contractor would get the money and offset the 1.1 million. So we'd be looking at about a $700,000 deficit that we would have to pay above collections.
Whereas the other way, we're probably talking maybe 200,
280, 200, 280-ish. Yeah.
somewhere in there. So
You're looking at half for they'll have us do it.
right, and plus you're keeping everything in town.
Plus we're keeping everything in town. Quality control is in town. Municipalities, we're not in the business to make a profit. So at the end of the year, at the end of the day, what it costs is what it costs. There's nothing above that.
Right. And when you sent out the RFPs, what was in there for accountability that you asked for?
So one of the issues I had, and I guess this is a good time to maybe talk about this. Currently in the 6 towns, we are in a system that would say zero bid, which means they only collected revenue from insurance and they didn't charge the towns. Well, that was one of the changes that came with us new providers when this contract is up in 2024 in March or end of February. They were going to start charging us. It was no longer going to be free. And so they were going to start charging us for a service, and then there was a lot of times we didn't have that ambulance available.
Right.
So it's
I
like,
think that's an important point.
That is-
there. The current ambulance service up until this point was free, and they got the money
free.
back from the transports. So I just want to make sure I understand that right. So what was going to happen March 1st? That's the correct date. Right?
Correct.
They were going to start charging the town,
They were going to start charging the town.
and that's where that 1 million plus number comes from.
That they never really told us what
Yeah.
their budget was. They just told us this is what your subsidy was going to cost.
Okay.
And that was going to be at least right around $100,000 for the 2 ambulances only.
Yep.
And so you're thinking now we're paying money
Yep.
to have a delayed response coming from another town, and then to be told weekly that their ambulance isn't available. So that wasn't a very viable option,
Sure.
right? So when we put together the request for proposal, what we outlined in there is that there would be expectations. If I'm going to pay a contractor to do something, if it's build my house or if it's to provide an ambulance service, you should have some type of protection there as the customer, right? So we put that in there that if you didn't staff the ambulance, you were going to have damage assessments. So if they couldn't find someone to work one day, they can't just say, well, sorry, we can't staff the ambulance today. And that's happened with our current provider now. We've gotten emails that, oh, one of the ambulances is down. So now you have 1 ambulance for 6 towns instead of 2. If they had extended response times, if they had other issues, there was damage assessments in that. Most of those assessments are time-based, if you will, response time-based, and they were almost double what the national standard is. And when we got our request for proposals back, all of the companies that sent a proposal back wanted to take exceptions to those. They didn't want to be held to that. And they're like, we don't currently have that within your contracts, and we can't start doing it now. And I'm like, well, if we're going to pay you a lot of money, we're going to hold you accountable for that. Right. And of course, it comes back that there are way more anyway. But at the end of the day, I wanted to make sure we were protecting our citizens.
And what's currently happening if they're in another town? Both ambulances are tied up for another town. Now the fire department would respond first, right?
So yeah, we're responding to the call. We're just not staffed with enough people and staffed with paramedics is the big thing to professionally and efficiently handle all those EMS calls. So we need a paramedic, and we just don't have enough of those currently on the staff, and we don't have enough staff working every day. So what would happen is we respond to the call. We're using the staffing that really is for the fire truck now to transport. So that entire time that we're tied up on that call, transporting to whatever hospital that we're going to, there's not much fire protection for the town, and there's not much for another call if another call came in.
Okay.
So.
All right. And about how many ambulance calls do you think you'd be able to handle at once?
So we'll be able to handle 2 at the same time. The first ambulance will be dedicated. The majority of our calls, when you look at historical data, which obviously it's emergency 911 stuff, right. So you can't guarantee that's always going to be like this, but historical data is pretty important in our business as well. That a majority of our calls, when we transport somebody, they'll be back available for the next call. Every so often we do have a couple calls back to back, or a couple calls where they've not cleared the hospital and we'd have to run a second call. Mm-hmm. So our current staffing that we're going to have will give us a chance to run that first call and a second call if a second one came in, and then we could use that reserve ambulance for that particular run.
Okay. I'm listening to everything. I think it sounds like an exciting opportunity for the town. Just really for the safety of everybody in the town, not having to wait, because time could equal a life, right?
Time matters in what we do in public safety, and time matters in pre-hospital emergency care. Mm-hmm. So we have a little phrase that we say is that time is tissue. Mm-hmm. If you're having a heart attack, the longer it takes for us to get there, assess you, transport you to the hospital, the more damage is done to your heart. Mm-hmm. That doesn't regenerate, right? When you damage heart muscle, it's going to be damaged the rest of your life, and it can impact your quality of life. Mm-hmm. Depending on how much gets damaged. So it's important that we not just get there quick, but we get you to the appropriate hospital quick. Same thing with a stroke patient. You know, if you suffer a stroke or you're having stroke symptoms, time is tissue, time is brain tissue. That we have to get there quick. We need to assess you and then get you to a hospital that has neurological specialty services. So they might be able to give you a medication to hopefully reverse the stroke symptoms. If not, you're probably going to be permanently disabled with those for the rest of your life.
And that would be the other thing, depending on what you see when you arrive to the scene. Is there one hospital you would always go to, or would it depend?
So it depends on, each hospital offers different things. So like we got this new emergency room here in town, which is going to be a great asset for us to transport to. They've already had probably now over 20 patients transported that ER in a week that they've been open from around the communities, not just from Plaistow, but from around. So we want to make sure we get the patient to the right hospital, not just the closest hospital. So, for example, if you're having a heart attack, you're having chest pain, and we show up, we assess you. One of the assessment tools that we use is a cardiac monitor, and that cardiac monitor, it shows that you're actually having a heart attack. We're not going to take you to this local emergency room. Mm-hmm. They don't have what you need. You need to get to a hospital that's got what's called a heart cath lab. Mm-hmm. So that's going to be either Exeter, Lawrence General Hospital, or Holy Family Methuen. Okay. So we work with them, and then we're going to get you to that closest facility there. Same token, like if you're in a traumatic accident, you know, unfortunately here lately we've had a lot of bad motorcycle crashes. And that patient that might have traumatic injuries, this local emergency room can help if we need to stabilize, mm-hmm. but eventually we need to get them to a more appropriate facility, which would be either Lawrence General or a level 1 trauma center like in Boston or Portsmouth.
So you'd still have the capability of med flighting if needed?
Well, I absolutely will still use our medical helicopter services. Okay.
That was really what I had for questions. Was there anything you needed to add, something I may have missed?
I don't think so. I think the most important thing is to make sure that the people in the community understand that this is nothing that just started. This is nothing that we have decided to do last month. Yeah. This has been going on now for a good 18 months, if not longer. A lot of conversations with the other communities because this impacts some of what's going on with them as well. A lot of communication with billing companies to help determine what our projected revenue is. So one of the processes we looked at was called a billing matrix, and that is we looked at 18 months worth of data from patients that were transported out of Plaistow on what methods of payment that they've been using. What they have: Medicare, Medicaid. They have a private insurance company. Is that private insurance company Blue Cross, Anthem? Are they non-insured? So we look at 18 months worth of data, we send it to 2 different billing companies, and then they help project our revenue. So you can speak with some type of authority that the projected revenue is going to be really close to what we think it's going to be.
Yep, and that's the one thing to make everyone understand. The revenue will come back to the town, back to the general fund.
Absolutely. That goes right back into the general fund.
That's a big part, and I think the other real big part is just having the ambulance paramedics in town. That's going to save time.
It's going to save the improvements you've seen us be able to perform in the last 4 years with staffing at the fire station for the fire truck. You're going to see that same improvement in pre-hospital emergency care.
Okay.
Our average response time is around 4.5 to 5 minutes, mostly more than 4.5 minutes. That ambulance is going to be in your front door in 4.5 minutes.
Right.
And now it's coming from Atkinson or Hampstead, so you could understand the drive time difference. It's going to take a lot longer for it to get there.
Perfect. All right then, is there anything else you wanted to add?
This, again, I want to reiterate that I'm sure people might have questions or concerns. Please call the fire station, ask for me, come by, ask for me, and then we'll be posting soon some different venues that we're going to come and speak at. Bring questions. I'll be glad to ask you, and I'll be glad to show you anything I can.
Right, and please take advantage of those events that we have that we will have out there for the public to come and ask the questions. This is your town, so you should have all your questions answered. That's very important. Thank you for watching, and please look for when we're going to have those events out there, and stop by, see the chief for any questions. And thank you very much tonight.
Thank you.
It was a pleasure.
Thank you.
Thank you.